Hi everyone, welcome back to my channel. In this video, we will solve CPC exam practice questions related to 60,000 series. Watch the video till the end, you will get an idea how to solve the questions in your exam. Let us start with the first question. Read the question. A 35-year-old has neuroplasty performed in the wrist for carpal tunnel syndrome. The palm is opened through a curved incision and further skin flaps are developed. The ulnar origin of the transverse carpal ligament is divided, decompressing the carpal tunnel. Tension of the nerve is released and the incision is sutured in layers. What CPT code describes this procedure? Let us check the options. Check option A, 64721. 64721 is for neuroplasty or transposition, median nerve at carpal tunnel. And option B, 64719 is for neuroplasty or transposition, ulnar nerve at wrist. And option C, 64708 is for neuroplasty, major peripheral nerve, arm or leg open other than specified. And option D, 64704 is for neuroplasty, nerve of hand or foot. In the scenario, they have mentioned neuroplasty performed in the wrist for carpal tunnel syndrome. And also they have mentioned the ulnar origin of the transverse carpal ligament is divided, decompressing the carpal tunnel. So which among these four codes is the right one? The right code is 64719, which is for neuroplasty, ulnar nerve at wrist. Right. In the scenario, there is neuroplasty performed in the wrist and ulnar nerve is involved. So we are using the code 64719. Okay. We'll eliminate other options. Option A will be eliminated because that is for median nerve at carpal tunnel. In the scenario, they have not mentioned median nerve. Right. So eliminate option A. And option C, 64708 will be eliminated because that is for neuroplasty, major peripheral nerve, arm or leg open other than specified. So that is not matching with the scenario. In the scenario, they have given neuroplasty performed in the wrist and there is ulnar nerve involved. So we'll eliminate option C. And option D, 64704 is for neuroplasty, nerve of hand or foot. But in the scenario, they have mentioned neuroplasty performed in the wrist. Okay. So we cannot code for nerve of hand or foot. That is 64704. So eliminate option D. You can also find the answer by looking at the index neuroplasty. Under neuroplasty, you can search ulnar at wrist. So it will directly lead you to the code 64719. Let us move on to the next question. Read the question. A 30-year-old male has lumbar facet syndrome. The affected nerve in the facet joints of lumbar region is destroyed by a neurolytic agent in the right segmental medial branches, innervating facet joints L3 to L4 and L4 to L5. So what CPT codes are reported? Let us check the first codes from each option. In option A, first code 64493, that is for injection, diagnostic or therapeutic agent, paravertebral facet joint with image guidance, lumbar or sacral, single level. And 64635 is for destruction by neurolytic agent, paravertebral facet joint with imaging guidance, lumbar or sacral, single facet joint. And the code in option C, 64483 is for injection, anesthetic agent or steroid, transforaminal epidural with imaging guidance, lumbar or sacral, single level. And option D, first code 64633 is for destruction by neurolytic agent, paravertebral facet joint, nerves with imaging guidance, cervical or thoracic, single facet joint. So, which among these four codes is the right one? If you chose the code 64635, then you're absolutely right because the code 64635 is for destruction by neurolytic agent. In the scenario, you can see they have mentioned destruction by neurolytic agent, right? And it is in the lumbar region. So it is exactly matching with the code 64635. We'll eliminate option A 64493 because that is for injection, diagnostic or therapeutic agent, paravertebral facet. But in the scenario they have mentioned the affected nerve in the facet joints of the lumbar region is destroyed by neurolytic agent. So it is not injection, diagnostic or therapeutic agent with imaging guidance, lumbar or sacral, right? So 64493 is wrong. So directly eliminate option A, because if one code is wrong, the entire option will be wrong. And we'll eliminate option C 64483 because that is for injection anesthetic agent, transforaminal epidural. So that is also wrong. Eliminate option C. We'll eliminate option D 64633 because that is for destruction by neurolytic agent, paravertebral facet joints. That is correct. But in 64633 they have mentioned cervical or thoracic. But we have to code for lumbar region. That is 64635. We are not supposed to code 64633. So eliminate option D. Option B is the right answer. In option B, the second code is 64636. That is for lumbar or sacral, each additional facet joint. So here you can see in the question they have mentioned facet joints L3 to L4, L4 to L5. So there are two facet joints, right? So the first facet joint is coded by 64635 and for the second facet joint we are using the code 64636. Therefore, the right answer will be option B. Let us move on to the next question. Read the question. An infant born at 33 weeks underwent 5 photocoagulation treatments to both eyes due to retinopathy of prematurity at 6 months of age. The physician used an operating microscope during these procedures. These treatments occurred once per day for a defined treatment period of 5 days. How do you report all of these services? In all the options, they have mentioned the code 67229. So the code 67229 is for treatment of extensive or progressive retinopathy, 1 or more session, preterm infant, performed from birth up to 1 year of age, photocoagulation or cryotherapy. Okay, so in the scenario they have given 5 photocoagulation treatments to both eye due to retinopathy of prematurity. So 67229 is the right code. Okay, and in the scenario the treatment is given to both eyes, right? So it will be a bilateral procedure. Below the code 67229 you can read a parenthetical note they have given. For bilateral procedure use modifier 50 with the code 67229. So the right answer will be option A. In option B, C and D, you cannot say modifier 50. So you can directly eliminate those options. In option B, they have multiplied the code 67229 5 times. We are not supposed to multiply this code because in the code description it's given 1 or more sessions, right? So it includes all the sessions. We are not supposed to multiply that. So eliminate option B. And in option C, second code is 69990. 69990 is for microsurgical technique requiring use of operating microscope. In the scenario you can see there is use of operating microscope, right? But above the code 69990 you can read there is a note. We should not report 69990 in addition to procedures where use of operating microscope is an inclusive component. Below that you can see the code range 650912 68850. So the code 67229 will be in that range, right? So we are not supposed to use 69990 with 67229. Eliminate option C. And in option D, they have mentioned 67229 without modifier 50. But for bilateral procedures, we have to use modifier 50. So eliminate option D. Option A is the right answer. Let us move on to the next question. To study guidelines related to 60,000 series, that is endocrine system, nervous system, eye and ocular adnexa and auditory systems, check the playlist CPC Exam 60,000 series. The link will also be mentioned in the description. And also don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery. Read the question. What is the correct CPT code for the decompression of median nerve found in the space in the wrist on the palmar side? Let us check the options. Check option A 64704. 64704 is for neuroplasty, nerve of hand or foot. And option B 64713 is for neuroplasty, major peripheral nerve, arm or leg, brachial plexus. And option C 64721 is for neuroplasty or transposition, median nerve at carpal tunnel, and 64719 is for ulnar nerve at wrist. So which among these is the right code? The right code is 64721, that is for neuroplasty or transposition, median nerve at carpal tunnel. And in the scenario you can see there is decompression of the median nerve, right? So the key term to find the right answer was median nerve. So the right code is 64721. We'll eliminate option A 64704 because that is for neuroplasty, nerve of hand or foot. But we have to code for median nerve. So we'll eliminate option A. Option B 64713 is for neuroplasty, major peripheral nerve, arm or leg, open, brachial plexus. So in the scenario they have not mentioned brachial plexus, right? So eliminate option B. And option D 64719 is for neuroplasty, ulnar nerve at wrist. But we have to code for the median nerve, not ulnar nerve. So eliminate option D. Option C is the right answer. Let us solve another question. An extracapsular cataract removal is performed on the right eye by manually using an iris expansion device to expand the pupil. A phacoemulsification unit was used to remove the nucleus, and irrigation and aspiration was used to remove the residual cortex, allowing the insertion of the intraocular lens. What code should be used for this procedure? Let us check the options. Check option A 66985, that is for insertion of intraocular lens prosthesis not associated with concurrent cataract removal. Check option B 66984, that is for extracapsular cataract removal with insertion of intraocular lens prosthesis, manual or mechanical technique without endoscopic cyclophotocoagulation. Check option C 66982, that is for extracapsular cataract removal with insertion of intraocular lens prosthesis, manual or mechanical technique. And check option D 66983, that is for intracapsular cataract extraction with insertion of intraocular lens prosthesis. So can you think of the right answer? The right code is 66982. Because that is for extracapsular cataract removal, which is mentioned in the scenario, and there is insertion of intraocular lens prosthesis. In the scenario they have mentioned insertion of intraocular lens, and they have mentioned phacoemulsification. In the code 66982 there is phacoemulsification, and in the scenario you can see they have mentioned using iris expansion device, right? In the code 66982 also they have mentioned requiring devices. So the appropriate code is 66982. Okay, we'll eliminate option A 66985 because that is for insertion of intraocular lens prosthesis not associated with concurrent cataract removal. But in the scenario there is an extracapsular cataract removal, right? So we have to eliminate option A. And coming to option B 66984, that is for extracapsular cataract removal with insertion of intraocular lens prosthesis, irrigation, aspiration, phacoemulsification, that is correct. But in the code they have not mentioned use of device, right? In the code 66982 there is use of device. In the scenario also they have mentioned iris expansion devices used. So we choose the appropriate code 66982. So eliminate option B 66984. You may get confused between the codes 66982 and 66984, right? So the keyword to choose between these codes is iris expansion device. If in the scenario device is mentioned, then you have to use the code 66982. And option D 66983 is wrong because that is for intracapsular cataract extraction. In this scenario, they have mentioned extracapsular cataract removal. Right? So eliminate option D. So that's it for today. In the next video, we'll solve some more questions related to 60,000 series. So stay tuned.